Initial diagnosis and management of Parkinson's disease. J.K. Johnson, D.O., Objectives. Be familiar with how to make the diagnosis of Parkinson's disease. Be aware of some of the differential diagnostic considerations of patients who present with Parkinsonism. Understand the current medical and surgical options for Parkinson's disease. Parkinson's disease diagnosis. Rest tremor, often unilateral. Rigidity. Akinesia or bradykinesia. Postural instability. The usual criteria for a clinical diagnosis of Parkinson's disease requires at least two of these four features: Parkinson's disease non-motor symptoms, depression and dementia, autonomic symptoms, constipation, orthostatic hypotension, detrusor muscle hyperactivity, sleep disorders, RLS, EDS, sleep fragmentation, REM behavior sleep disorder, anosmia. Parkinson's disease diagnosis. Features most suggestive of Parkinson's disease include asymmetric or unilateral onset, tremor at rest, good response to levodopa. Parkinson's disease suspect and alternative diagnosis. Rapidly progressive course, lack of dopaminergic response, early postural instability, cerebellar signs, early autonomic features, pyramidal signs, rapidly progressing or early dementia, supranuclear gaze palsy, slowed saccades. Parkinson's disease suspect and alternative diagnosis. Early falls, symmetry of motor manifestations, lack of tremor. Treatment of Parkinson's disease. Neuroprotective, surgical, symptomatic, non-pharmacologic. Treatment of Parkinson's disease. Neuroprotective. At present there are no proven neuroprotective therapies. Minocycline, creatine, caffeine, coenzyme Q10, estrogen, pramipexole, ropinirole, rasagiline, GPI 1485, GM1 ganglioside are currently in clinical trials. 9s. Treatment of Parkinson's disease. Surgical. It will often reduce off time in dyskinesia. Indicated in advanced patients who are not being helped with their current therapy and have a significantly reduced level of function. Surgery does not cure and doesn't help symptoms that aren't or haven't responded to dopaminergic therapy. Treatment of Parkinson's disease. Symptomatic. Levodopa, MALB inhibitors, dopamine agonists, ergot and non-ergot, COMT inhibitors, anticholinergic agents, amantadine. Treatment of Parkinson's disease. Levodopa, the most effective drug in the treatment of Parkinson's disease. It helps the symptom of bradykinesia and rigidity best, will often help the tremor as well. Postural instability responds the least. It is combined with a decarboxylase inhibitor. Treatment of Parkinson's disease. Levodopa. Immediate release carbidopa/levodopa, Cinemet, 10 100ths, 25 100ths, 25 250. Parcopa is immediate release formulation that dissolves under the tongue. Cinemet CR is a controlled release formulation, 25 100ths and 50 200. Treatment of Parkinson's disease. Levodopa, dosing. Treatment is usually started with 25 100ths immediate release half to 3 per day. Most patients get a response at 300 to 600 mg per day of levodopa. Controlled release levodopa preparations usually require 30% more to achieve a clinically similar effect. Treatment of Parkinson's disease. Levodopa, adverse effects. Confusion, hallucinations, delusions, agitation, psychosis. Nausea, dizziness, headache, orthostatic hypotension. Motor fluctuations. Treatment of Parkinson's disease. MALB inhibitors. Selagiline, Aldiprol, 5 mg AM. Rasagiline, Azilect, half a milligram to 1.0 mg. Selagiline orally dissolving tablet, Zelapar, 1.25 to 2.5 milligrams. Treatment of Parkinson's disease. MALB inhibitors typically don't produce a significant functional benefit, but is often used early in the disease course. These agents serve as an adjunct with levodopa. They may lessen development of motor fluctuations. Dyskinesias are not affected. Treatment of Parkinson's disease. MALB inhibitors. Mortality was not increased in patients taking these agents. Nausea, headache, confusion probably by enhancing the effects of levodopa. PDR warns against the use of these agents with tricyclics and SSRIs. Unlike non-selective MAO inhibitors, these agents don't precipitate hypertensive crisis in patients who ingest high tyramine foods. Treatment of Parkinson's disease. MALB inhibitors. SSRIs and the risk of the serotonin syndrome is very rare if present at the standard doses of the current MALB drugs. Sertraline is probably the safest SSRI to use. TCAs are often used as well, but be careful about anticholinergic side effects. Treatment of Parkinson's disease. Dopamine agonists. Bromocriptine, pergolide, pramipexole, ropinirole, apomorphine, injectable. Treatment of Parkinson's disease. Dopamine agonists. These are synthetic agents that directly stimulate the dopamine receptor. They were initially developed for adjunctive therapy with levodopa but can be used as initial therapy. They are very effective for use in patients who develop motor fluctuations and dyskinesias. Treatment of Parkinson's disease. Dopamine agonists. Most patients who initially start on agonists will need to be on levodopa at some point. Pergolide, Permax, has been taken off the market, voluntarily by the manufacturer. Oral dopamine agonists need to be started slowly and the effect is not quick. Treatment of Parkinson's disease. Dopamine agonists. Patients on dopamine agonists may develop impulse control problems. The adverse effects of dopamine agonists are similar to levodopa. Peripheral edema is more common with agonists. Elderly and demented patients are more susceptible to psychiatric side effects. Warn patients about sleep attacks. Treatment of Parkinson's disease. Dopamine agonists. Dopamine dysregulation syndrome, a cyclical mood disorder with hypomania and possible manic psychosis. Impulse control disorders including hypersexuality and pathologic gambling may occur. Treatment of Parkinson's disease. COMT inhibitors. Talcapone, Dasmar. Entacapone, Compton. Entacapone/carbidopa/levodopa, Stalevo. Treatment of Parkinson's disease. COMT inhibitors. These drugs are ineffective when used alone. Used mainly in patients with wearing off. Talcapone is associated with hepatotoxicity and is rarely used in the U.S. Treatment of Parkinson's disease. Anticholinergics. Trihazyphenidyl, Artane. Benzotropine, Cogentine. Treatment of Parkinson's disease. Anticholinergics. Most useful in patients with tremor predominate Parkinson's disease and age less than 65. Do not use in patients with a dementia. Treatment of Parkinson's disease. Amantadine probably has multiple mechanisms of action. Is used to treat symptoms of akinesia, rigidity, and tremor. Is often used to treat dyskinesias in patients already on levodopa. Side effects include livedo reticularis, ankle edema, confusion and hallucinations. Summary. Treatment of Parkinson's disease recommendations. Either carbidopa/levodopa immediate release or a dopamine agonist can be used as initial therapy in patients who are functionally impaired. Levodopa preparations are the most effective agents for the treatment of Parkinson's disease. It is reasonable to initiate therapy with a dopamine agonist in younger patients. Treatment of Parkinson's disease recommendations. Pergolide, Permax, should be avoided. Anticholinergics can be used in younger, 65 or less, tremor predominant patients. MALB inhibitors produce a symptomatic benefit that is mild, and these agents are often used early in the treatment of Parkinson patients. Treatment of Parkinson's disease recommendations. Surgery for Parkinson's disease is a reasonable treatment in selected patients.